Hi, Mercy here. I am a doctor of nursing practice, a psychiatric mental health nurse practitioner. How are you doing? How have you been? I like to talk about mental health issues, wellness issues, your thoughts, your emotions, your feelings. And today, let us continue with our A to Z series of mental health issues. The topics are completely chosen by you. The first one was anxiety, the second was bipolar. The C word of choice or issue of choice by you was community, and the D one was drug abuse. Today, let's continue with our E1, which is emotional stability or emotional instability. What is stability and what is your emotion? Your emotions are those feelings inside. How are you doing with them? Do they control you or do you control them? Are your emotions stable? Are they steady? Are they maintained? Are they in a state of equilibrium? We all know that if your emotions are all over the place, that shows in different genres, in different areas of your life. If your emotions are all over the place, trust me, your life may not be going the right direction. Your life may be all over the place as well. And sometimes we do not choose for our emotions to be all over the place. Some underlying situations or some life challenges or some invisible pain or some invisible things going on that causes our emotions to be all over the place. Remember, you do not have to go through this alone. Seek help.
Emotional stability, often referred to as emotional dysregulation, is a common symptom in various mental health conditions. It can manifest differently in each individual, but there are common signs and symptoms associated with emotional instability. If you or someone you know is experiencing these symptoms, it's important to seek help from a mental health professional for a proper diagnosis and treatment. Here are some common symptoms of emotional instability in the context of mental health. Frequent and intense mood swings, which can include sudden shifts from extreme happiness to deep sadness or anger, often without an apparent trigger. Experiencing intense anger, irritability, or frustration that may lead to outbursts, aggression, or impulsivity. High levels of anxiety, which may include excessive worry, panic attacks, restlessness, and difficulty controlling anxious thoughts and feelings. Depression, frequent periods of sadness, hopelessness, and low energy. Individuals with emotional instability may have episodes of major depressive disorder. Fear of abandonment, a strong and irrational fear of being abandoned or rejected by loved ones, leading to clingy behavior in relationships. Impulsivity, acting without thinking through the consequences, which may result in risky behaviors such as substance abuse, reckless driving, or self-harm. Unstable relationships, difficulty maintaining stable and healthy relationships due to emotional volatility, leading to conflicts and breakups. Self-harm or suicidal ideation, engaging in self-destructive behaviors such as self-harm or suicidal thoughts. It's crucial to take these signs seriously and seek immediate help if you or someone you know is at risk of self-harm or suicide. Identity disturbance, a lack of a stable self-identity which can lead to changes in self-image, goals, and values over short periods. Difficulty coping with stress, finding it challenging to cope with stress and adapt to changes, often leading to emotional distress. Paranoia or dissociation, experiencing periods of paranoia or dissociation where individuals may feel detached from reality or have difficulty distinguishing between what's real and what's not. Intense fear of rejection or criticism, an overwhelming fear of being criticized or rejected, which can lead to perfectionism or avoidance of social situations. Impaired impulse control, difficulty controlling impulses, especially in response to strong emotions, leading to behaviors that may be regretted later. Now, when emotionally stable, your state of mind and emotional well-being can be effectively managed. The emotions and reactions to situations happens in a balanced way and maintain a sense of inner calm and resilience. Here are some key concepts to understand about emotional stability. Self-awareness. Emotional stability starts with self-awareness. It's important to recognize and understand your own emotions, triggers, and underlying reasons for your feelings. Self-reflection and introspection can help you gain insight into your emotional patterns. Emotional regulation. Effective emotional regulation is a core component of emotional stability. This involves managing your emotions in a way that doesn't lead to impulsive or harmful actions. Strategies for emotional regulation include deep breathing, mindfulness, and techniques like cognitive behavior therapy. Stress management. High levels of stress can disrupt emotional stability. Learning stress management techniques such as exercise, meditation, or time management can help you cope with stress in a healthier way. Healthy communication. Clear and open communication is essential for emotional stability in relationships. Expressing your thoughts and feelings honestly while also being a good listener can improve the quality of your relationships and reduce emotional conflicts. Boundaries. Setting and maintaining healthy boundaries is crucial. It involves knowing when to say no, respecting personal space, and understanding your own limits. Healthy boundaries can prevent emotional exhaustion and conflict. Developing effective problem-solving skills can help you address challenges and conflicts in a constructive way, reducing emotional turmoil. This may involve breaking down problems into manageable steps and seeking support when needed. Resilience. This is the ability to bounce back from adversity. Social support. Having a social support network of friends, family, or a therapist can be instrumental in maintaining emotional stability. Sharing your thoughts and feelings with trusted individuals can provide validation and emotional relief. Self-care, taking care of your physical and mental well-being, is essential. Regular exercise, eating a balanced diet, adequate sleep, and relaxation techniques can contribute to emotional stability. Professional help. If you find it challenging to maintain emotional stability on your own, seeking the guidance of a mental health professional can be beneficial. They can provide therapy, counseling, or medication when necessary. It's important to know that emotional instability can be a feature of several mental health disorders, such as borderline personality disorder, bipolar disorder, and certain mood disorders. The symptoms and their severity can vary from person to person. If you or someone you know is experiencing emotional instability and is interfering with daily life, it is essential to seek help from a mental health professional who can provide a proper diagnosis and recommend appropriate treatment options such as therapy, medication, or a combination of both. Early intervention can lead to improved emotional regulation and overall well-being.